Welcome to today's town hall on COVID-19 health issues. I'm Dylan Blaylock with Clackamas County Public and Government Affairs. I can see we've got a lot of interest. We've got nearly 45 attendees so far, and the numbers going up. So thank you very much for joining us today. The purpose of today's town hall is to provide accurate, updated COVID-19 public health information from experts to the leaders of jurisdictions, public entities, and emergency service providers in Clackamas County that have essential workers. For the audience today, we've invited representatives and workers from school districts, Clackamas Community College, the Educational Service District, AMR, fire districts, law enforcement like police and sheriff, city managers, and water districts. This session will be archived to YouTube once it is done for sharing among this universe. Today we have two guests that the audience can pose questions to. Dr. Sarah Present is the Clackamas County Health Officer, which makes her the Chief Clinical Public Health Advisor for Clackamas County. She provides medical direction for programs within the Clackamas County Public Health Division and to external partner organizations. And you've probably seen her on the news a lot recently. Dr. Present, thank you very much for joining us. Oh, I think you're muted.
Hi, everybody. Thank you for having me.
Very good. And also with us is Dr. Ritu Sani. He's the Emergency Medical Services Director of both Washington County and Clackamas County. He has served fire-based, private, and third service EMS agencies, as well as he's been the Medical Director of Air and Ground Critical Care Services. He was the first Oregon State EMS Trauma Medical Director, and he currently serves on the governor's COVID-19 EMS task force. Dr. Sani, thank you so much for joining us.
Thanks, Dylan. Thanks for having me. Great to be here.
Great. This is how today is going to work. In a moment, I will ask the doctors to provide any opening statements they'd like to, and then I'm going to ask some questions that county staff have already been fielding recently regarding health practices. After that, I'll open it up for questions from the audience. I'll go through how to ask a question again later, but just so you know, when the time is right, if any attendees would like to provide a comment, you'll be prompted to do so by utilizing the raise hand feature on Zoom. The raise hand button is on the Zoom bar. That's at the top or bottom, depending on your device. Again, we will take questions a little later. If you're joining us on the phone, you can also hit *9 to indicate you have a question. I see we have a total of 5 phone-in listeners so far. Again, you can hit *9 to indicate you have a question. I will prompt you when the time is right. I'd also like to stress from the get-go that the doctors are here to answer medical and health related questions only. They are not going to be handling operational questions. That's not really their purview. Clackamas County has an entire emergency operations center set up, which deals with operations in part. If you have a question regarding operations, you're welcome to send it to eocpio@clackamas.us, and we can get it to the right person. Again, that's eocpio@clackamas.us if you have operational questions, but medical questions only for the doctors today, please. Thank you. And with that, we're going to get started. Dr. Present, is there anything you'd like to say at the beginning of the conversation here?
Yes, Dylan, thank you so much. Thank you all for having me. Again, I am Dr. Sarah Present. I am a Deputy Tri-County Health Officer and act as the Health Officer for Clackamas County. What that means is that I work really closely with the health officers in Multnomah and Washington counties, as well as across the state of Oregon and Southwest Washington. We all, as a health officer and health leader community, are doing our best to coordinate information sharing, and management of this unprecedented event across our region and our state. I really want to thank you all for being here on this webinar today, and I really want to thank you for all of your service to our community in Clackamas County. I know that all of us have already been working really hard for what seems like a long time, doing all that we can do to keep our community safe. And many of us are already hoping for a renewed sense of normalcy, and unfortunately we can't say when that's going to be. What I can say is that the work that we are doing here and what each of you are doing in your organizations is working. I have a lot of hope for the way that our region and our county are managing this unprecedented pandemic event. Our social distancing efforts started early in our region and county course of the disease. Our healthcare systems feel prepared and ready, and our community is strong and resilient and banding together to keep each other safe. I see every day people doing the right thing to help prevent the spread of this disease. Currently in Clackamas County, we have about 50 confirmed cases. I haven't gotten the total number for this morning, but we're getting a handful of cases every day that are confirmed, and unfortunately 3 deaths. Of those cases, the ones that are hospitalized and the unfortunate fatalities are primarily in those with the known risk factors that are consistent across areas affected by this disease, which are elderly and those with underlying medical conditions. For more information for the public, we have worked with our regional partners. There's now a data dashboard up on the Multnomah County website and will soon be up on our website with a link to hospitalizations, deaths, demographics of the cases, how many cases there are, and this is in a quad county region for Clackamas, Multnomah, Washington, and Yamhill counties. So I will, we can send out links for that data dashboard, which may be helpful for you. In addition, the state of Oregon has started putting out in their daily SITSTAT the number of hospital beds, ICU beds, NICU beds, pediatric beds that are available and that are used. And what I can say right now is that things really do look reassuring. There are a few different modeling reports that are out there with some different numbers, and a lot of that is honestly because there's a lot that's unknown about this virus and how it's spreading. We all have to sit with the discomfort of having unknowns of a new virus and do the best that we can to make the best predictions. And what I see so far, again, I am feeling hopeful. We here in the Clackamas County Emergency Operations Center are working tirelessly to help get the information to you about how you can also work to help protect our community. We have a logistics branch working on the allocation of resources as well as a number of other things. Operations is involving the public health department's investigation of each case, and I can talk more about how we're doing case investigations at this point, really focusing on protecting the vulnerable populations like those in long-term care facilities. Operations is also looking at making sure that we have availability for alternate care sites. So if we need increased access for people to leave the hospital and have a place to go who are otherwise unable to go home. If there's other hospital capacity that we need to meet, we have plans in place. And the business operations section is working tirelessly to help figure out how the effects on our economy can be mitigated as best possible. Again, we're still learning a lot about this virus. There's a lot still to learn about its spread and about how our community will be impacted. But I'm really glad for this opportunity to talk with you and to share the information that we have and help answer the questions. Thanks.
All right, thank you very much, Dr. President, and thanks for everything you've been doing since, gosh, the early February. Late, I don't know, it's a bit of a blur to me. I'm sure.
That was 52 years
that we
ago.
stood up
Yes.
our public health team.
Right. Well, thank you for all the work that you've been doing in the community for that, and thank you for that statement. Dr. Sani, would you like to go ahead and say anything before we get into some of the questions?
Yeah, I don't have nearly as prepared a report as Dr. President.
That's okay.
I just want to let you know that as the medical director for 2 counties, I work very closely with our ambulance providers as well as many of our fire departments. Our focus has been on sort of monitoring the situation and trying to do all we can to ensure that our EMS practitioners, our firefighters, our paramedics, our EMTs are able to provide the best care they can in the safest manner possible. And we've been working pretty tirelessly to do that. We also are feeling pretty positive these days about the projections that we've seen, but we also continue to plan. As Mel Brooks said, we hope for the best and expect the worst. And so we are continuing to plan as to how we're going to operate our fire and EMS services should things get a lot worse, but are feeling much better today after looking at, in the last few days, after looking at the projections than we were kind of a week or 2 ago.
Okay. Okay, great. Thank you very much for that, Dr. Sani. And thank you again to both you and Dr. President for everything you've been doing. I know this has been trying times for everybody in our community and family members with lockdown. I can't imagine how it is for both of you and others in the health field for trying to keep all of us safe. So thank you very much on behalf of
I
everyone.
did want to say one more thing that I meant to say. I had it
Sure.
even written down, which is that as a frontline providers of emergency care, I work in an emergency department. I just want to, those of you who are kind of facing the community, I just want to thank you. This is really hard. Just like regular daily, shouldn't think about it type of things suddenly feel like there could be threats or worry. And so even though logically, I think in most cases we're very well protected, it doesn't change the fact that emotionally this is very difficult. So I just want to thank everybody for being there and the work you've done, and understanding that in some of your roles you have to continue to interface with the community. And I really, really appreciate it.
Hear, hear. Thank you very much, Doctor. Okay, so we're going to go ahead and start with questions. Again, for all attendees, I will prompt you when the time is right. I'm going to start off with some questions that we've gotten in the Emergency Operations Center, very common over the past couple of weeks. Once we go through those, I will open it up for questions from the audience that we have. But to start things off first, doctors, what is the current guidance for frontline essential employees to stay healthy and safe while doing their jobs right now?
I can take these. So the guidance for essential employees is really to follow the measures that we have been putting out from the beginning of this around basic proven techniques of hygiene, which is washing your hands often with soap and water for 20 seconds. If soap is not available, using alcohol-based hand sanitizer with at least 60% alcohol. Avoid touching your eyes, your nose, your mouth with unwashed hands. Avoid close contact with sick people. Stay home when you're sick. Cover your cough or sneezes. We know that people do have coughs and sneezes that are not COVID, but really, really being on a heightened alert for any signs of illness. Frequently clean and disinfect everything you touch, and then practice the social distancing while at work as much as possible. So we talk about the 3 to 6 foot distance between people. We do feel that for asymptomatic people who are not coughing and sneezing, 3 feet is probably enough for any of these respiratory droplets to be able to go. 6 feet is protective in that that's a pretty good cough or sneeze that gets respiratory droplets 6 feet away from somebody. But that's where our social distancing recommendations come from, is how far a droplet from the respiratory system, from the mucous membranes, can typically move during normal interactions with people. We are learning about theories around asymptomatic spread, which I think we could talk more about later. But we also know and are fairly confident that the highest point of contagion is when people are showing symptoms. They are the most contagious at that point and early in the symptoms. So if you are at work and you start feeling ill, isolate yourself immediately, remove yourself from the workplace, and go home. And so for those to stay safe and healthy while at their jobs, who are essential employees, each individual should be following these measures themselves and looking out for other colleagues. Everybody should be empowered to say, hey, you don't sound so good. Do you need to go home? And not feel bad about that. And so everybody needs to be able to say, hey, you know what? You're within 3 feet of me. I'm going to ask that you step away, and not take that personally, and know that these are what we are asking to do to keep everybody safe. I think also maintaining personal health through good diet, through getting good sleep, through self-care as much as possible. This is an incredibly stressful situation for everybody, especially those who are out of their homes. Well, I can't say that. I think it's stressful for everybody, and everybody has different stressors. But being out of the home and interacting with others is one particular stress. So find those personal self-care things that you need to try to get good diet and good sleep. And that really goes a long way to help protect our immune systems. Dr. Sani, anything else you want to add?
I don't really have anything else. I think there's a specific question that somebody asked about our frontline emergency care workers. I can talk about that now, or I can wait till that question comes up. Dylan?
We'll wait till the question
Okay.
comes up, because we got a few more just to get through before we go to the phone lines and stuff. So great. Let me see. Well, the next question we were going to talk about that we hear is some essential tasks require staff to work closer than 6 feet away from others. How best should these? I'm sorry. Essential tasks require staff to work closer than 6 feet away from each other. How best should these activities be handled? I think it means, what about essential staff where it's, within 6 feet, obviously.
Yeah, I think that the general guidance doesn't really change that much. If you're working within within 6 feet, obviously making sure that if you are going to cough or sneeze, to cover that well, sneezing into your elbow or into your back of your knee. Oh no, not in the back of your knee, just your elbow. But and then just making sure that have practiced very good hand hygiene, so that you are not inadvertently sort of inoculating yourself. So anytime you're interacting even closer with somebody, using the sanitizer, soap and water. And then the thing that I personally find the hardest is to stay away from your face. My face is itching right now just thinking about it. But keeping your hands away from your face, your mouth, in particular nose, because these are the areas, the portals of entry of the virus, until you can sort of be a safer distance and hand hygiene. And then if you're a coworker and you feel sick, just get out of there. Don't get your other coworkers sick. And we're doing a lot of testing in the emergency department, not as much as I think as we'd like, but the majority of our tests by far are still negative, but that means there are still other viruses out there. So the last thing you want to do is get sick at all right now. So just, those are good standards for any virus, whether it's the flu or any other kind of cold upper respiratory infection.
Right. Okay, great. Thank you very much for that. Looking at some of the other questions we've got in the EOC, actually, I think both of your answers answered one of these, but here's a different one. What should an essential employee do if they have a family member that has been exposed or experiencing symptoms or is awaiting test results or has been confirmed for COVID-19? So assume somebody in their household.
So we have some guidance that will be going up on our webpage soon as well that specifically talks to if you have been diagnosed with COVID-19 and you're staying at home, or if you have a family member, or if you have symptoms and you're likely to have been exposed. Really staying at home when you are sick is incredibly important, as much as you can isolate within the home. So if there is a family member that there's a high risk that they have the disease, and the essential employee is not sick, not ill, we really do recommend isolating within the home as much as possible, so that other people within the home even don't get sick. We recommend identifying one caregiver for that individual and trying to keep pets away from them. We also realize that within the home, some of those recommendations are not very realistic. There are guidelines for healthcare workers around being exposed to known COVID cases without the appropriate personal protective equipment. And there is guidance to quarantine for any of the close contacts of a known case. However, there's also, especially within healthcare, but also for, I think, all essential employees, there is flexibility there. And it really depends on your employer and how they want to specifically manage that. I think our general guidance is that if you are not ill, it is okay to work. It is okay to perform your essential jobs well, you are well, with a heightened awareness for any symptoms you may have. If you are known to be exposed to a known case, we know that you are increased risk of getting the disease. And so really practicing those social distancing measures and really going home to limit exposure if you do become ill. The ability to isolate this disease is, we're past that. We're not gonna sort of isolate our way out of it. Many of us are going to be exposed. The vast majority of us will be fine and have mild symptoms, if anything. And so really just focusing on those social distancing and the hygiene is what's going to minimize the spread of this disease. I hope that answers the question.
I think so. All right. Thank you very much, Dr. President. Sort of along those lines, and we'll get to 2 more questions here before we open it up to all attendees. You were talking a little bit about how employers, handle the situations with essential employees. One of the questions we've gotten is, should employers providing essential services shut down if they have a COVID-19 exposure?
I can take that one also.
Go for it. I'll get the next one anyway. So
okay, perfect. No, as the ultimate answer. I think that identifying those close, so if there's a known case in a workplace, it's worth thinking about who had the closest exposure to them and making sure that they know. That ultimately is the job of the public health department. The employer does not need to alert everyone as to a possible exposure unless we in the public health department suggest that you do that. And a lot of that has to do with the actual specifics of the work that the case is doing and who their close contacts in that area are. Again, following all of the social distancing measures and frequent hygiene and cleaning and disinfecting measures limits the chance of individuals being close contacts in the workplace in the first place. So that's where we should all be focusing. And then for each case, we are focusing on those who are most at risk for either becoming very ill or spreading illness to others, and most essential employees fit into that category. So while public health may not be able to follow up with every case at this point, most essential workers are in our high-risk category that we will be following. We'll be doing contact notification. So those people who are close contacts to a case should be notified and get direct education from public health.
I think one of the corollaries, one of the things that I get asked a lot is, should we be testing our employees regularly if they've come in contact? And the guidance that we've been giving to all of our EMS and fire agencies is that there's currently no indication to testing an asymptomatic person. And that, I think, is even if with an exposure, and I think many of us are considering exposure kind of more likely in general, but we're not embarking on any sort of testing of people unless they're symptomatic.
Great. Thank you both very much. Okay, last question before these all sort of overflow into each other, but last question that will hit before we go on to all the attendees and their questions. A little bit more specific. What is the current guidance for law enforcement, fire, and other first responder agencies to protect employees? If there is any specific sort of guidance for those groups, uniquely.
I guess this would be mine, Sarah, since this is my job, right? So for law enforcement, the guidance is fairly similar to the sort of general population. The main goal is to keep your distance, and the main practice is practicing good hand hygiene, trying to prevent yourself from inoculating yourself if you've come into contact. We do have some specific guidance for law enforcement when they respond to medical emergencies that is more akin to sort of what we're asking from our medical side. On the medical side, for our fire and EMS colleagues, We are taking a bit of a more aggressive tactic in the sense that we feel that the risk of exposure is higher when somebody's calling 911, and especially around the complaints of I'm feeling sick, I have a fever, cough, those sorts of things. And so our crews are responding. First of all, they are currently responding like they always have. There's been no change in how we respond to 911 calls in terms of who we send, et cetera. But the first arriving crew may actually, if this was a lower acuity call, may actually attempt to contact you by phone, contact the patient by phone. And the crew in general is trying to minimize exposure. If they're unable to contact the caller by phone, the first arriving crew will send in one person. They will still maintain a distance of at least 6 feet if possible, to do what we call an initial scene size up. They are wearing N95 masks and gloves and face protection on all calls, because again, we feel that the risk profile of an ill person is just higher and more likely to put our folks at risk for exposure. And then we're also asking them to mask most, if not all, patients, because again, the risk is there. So our fire crews are being a little bit more aggressive in terms of their PPE. This follows CDC guidelines for EMS first responders. Again, because the likelihood of coming in contact with a person who's actively ill and shedding the virus is just higher.
Okay, great. Thanks very much for that. So now is the time that we're going to go ahead and open up the town hall for questions from the audience. If any attendees, I see we already have some hands raised. If any attendees would like to ask a question, you can please utilize your raise hand feature on Zoom. Your raise hand button is on the Zoom bar. That's at the top or bottom, depending on your device. And I will call on you and let you know when it is your time. We are going to go until 11:30, so we've got an hour, plenty of time to go ahead and ask and get through a bunch of questions here, or until we don't have any more questions. If you are on the phone, I know we have 5 total phone-in listeners right now. You can also go ahead and signify that you have a raised hand or you want to ask a question by hitting *9. And again, I will go ahead and call on you when the time is right and I bring you over. And again, I'll stress that doctors are here to answer medical and health-related questions only, not operational questions. Those can be sent to a website I will get, or to an email address I will get out on the chat here. So first up, we have someone with the moniker of Mayor Gamba. I can only go ahead and assume this is Mark Gamba of Milwaukee. Mayor Gamba, if it is you, if you could go ahead and you need to unmute yourself, and then you are on with the 2 doctors.
Thank you both for doing this, or all 3 of you for doing this. It's very helpful. I'm getting a lot of calls from folks. I have kind of a 2-part question here. I'm getting a lot of calls from folks that work in restaurants and grocery stores, and they are really desperately wanting better, more specific, more detailed protocols for their jobs. They're in tight spaces often, and obviously coming in contact with the public, in the pickups and drop-offs, and also obviously in the grocery stores. And the second part to that question is, I know that we're currently have a very limited testing capacity, but if and when we do get the promised 15-minute style test that we've heard about, do we have a new set of testing triage or a new concept around testing triage that will involve those kinds of frontline workers that come in contact a lot with the public?
Okay. Would any of the doctors like to take the first part of that with the health workers in restaurants?
Yeah, this is Dr. Present. So as for food and grocery workers, I know that our environmental health team has been working with the restaurants that we license to help give some, to help give the clear guidance that we have. I will talk with our PIOs about whether we need to put something more specific as far as our FAQs. But I do believe that there are some out there. I know that they are concerned about interacting with the public. The main thing is to distance as much as possible and practice that good hand hygiene and stay home when you're sick. You know, if there is, so for the understanding of this disease is that it is contact and droplet spread. And so the risk of actually getting the disease from sort of walking past somebody or very brief encounters, that is thought to be very low. There is increasing evidence around how long the virus can stay alive on different surfaces. The infectiousness of that is unknown, but that's why we talk about frequent disinfecting. I've seen grocery workers, disinfect their entire work site between each customer, and making sure that the lines have 6 feet between people, and working on putting up, plastic barriers or workplace controls, what we call the sort of environmental controls to help protect those individuals. There are many options there, and I have seen people doing those things successfully. And so I think that working with your licensing body to get clarity on what you can do, and then putting in those social distancing measures as much as possible really, really does go far to protect people. Again, like I said, it's not a reassuring thing, but it's a reality that many of us are going to be exposed at some point, and many of us will get this disease at some point. And the vast majority of us will be fine. The main reasons for all of the social distancing is to slow the spread of this disease, to help protect our hospital systems, to be able to care for those who are severely ill and make sure that they get the life-saving care that they need. And that is what will ultimately decrease the deaths and increase the recovery from this disease. So while that's not reassuring, there is some reality here of we need to make sure that we are able to provide these essential services. People do need healthy food, and that's an incredibly important service. And so employers and employees need to work together to make sure that everybody feels safe, given the restrictions and limitations we have. And I forgot the second part of that question because I rambled.
That's okay. I wrote it down, so I got a couple things to add to that, and then I'll try to capture the second part. The one thing I want to point out is the sort of false sense of security that you get with gloves. I've been going to the grocery store, like everybody else, to stock up, and I did ask a grocery store worker why they were wearing gloves, and they said because they don't have to wash their hands as much that way. And so just a reminder that if you're going to wear gloves, that if there's a droplet with virus on, it gets on your gloves, you then touch your face, you can still inoculate. The virus is not absorbed through the skin in the hands. I understand the sort of desire to wear gloves to some degree, but that doesn't mean you shouldn't Purell or change gloves or however you want to do it between sort of interactions. So I think it's really important that that gloves do not obviate the need for hand hygiene when you're talking about frequent interactions with customers or outside people. And the question on the second question by the mayor was the 15-minute style, the new 15-minute sort of bedside test. All I can tell you is that we've been sort of watching the developments here in terms of there are a couple of tests out there. One of the 15-minute tests is what's called an antibody test. It's actually I'm not sure the utility. It doesn't really rule out the virus in general, because it takes over a week before the antibodies convert. And so as tests come online and become available, and I can tell you that my email box is like, hey, come buy our test suddenly, like a bunch. I think we just have to look at each kind of test individually. Are they FDA approved? What are their limitations? et cetera. And, you know, one of the limitations of the current test is that it misses about 1 out of 4 people who may have COVID. So none of these tests are perfect.
Okay. Thank you very much, both of you. Mayor Gamba, does that get you what you need?
Yeah, thank you.
Okay. Thank you very much, sir. All right. The next question that we have is going to be from Shirley Skidmore. Shirley will give me 1 second. Bear with me. And then Shirley, if you could go ahead and unmute yourself, then you will be on to ask a question to the doctors.
Can you hear me okay?
Yes, we can.
Yep.
We have, I represent an education service district, and we have some superintendents with questions about all of the work they're doing in their communities to distribute food to students and families, tech workers distributing computers to families, daycare staff providing childcares for first responders, and wondering if those people should be wearing personal protective equipment, and if so, what does that equipment look like?
Thank you for that question. Sorry.
Go ahead. Go ahead.
Okay. I think that there are, as far as delivery, there are some similarities to what we just talked about with the food service workers, in that frequent hand washing. You know, if you are to wear any personal protective equipment, including gloves, make sure that you are well trained in how to use them and how to put them on correctly, but specifically how to take them off correctly so that you're not giving yourself that false sense of security. We talk also about the high risk of a false sense of security in wearing masks. There are a number of different like homemade masks right now, which I think is incredible that our community is wanting to band together and help, but we really don't know how protective those are, what those fabrics are made out of, if they actually will repel the viral particles, or do they absorb them in a way that actually puts you at higher risk of getting the disease. We need to be really careful about what we're using and how we're using it. We generally are not recommending mask use for the general population outside of healthcare personnel. And that is because it, at this point, is not shown to protect the individual wearing the mask, and it can be falsely used. So if you are wearing a mask, but then you end up touching your mask and fidgeting with it, then you might have a greater risk of getting those viral particles on your hands and then inoculating yourself, similar to what Dr. Sani was saying. We do recommend mask use potentially to put on an ill person when you are interacting with them. So an ill person has the greater risk of spreading those viral particles through coughing, through sneezing. And so putting that mask on can help sort of keep those viral particles closer to them and away from well individuals. But that really is the only recommendation for masks in the general population right now. You may have seen that the CDC and the President's task force are reevaluating that. We might have different information soon. I also can say that we are faced with a worldwide shortage of PPE, and so we need to make sure that we are using it smartly and correctly. And so for most of the individuals that you were just referring to, no, I don't recommend wearing.
Yeah, I was just going to say, I don't think there's any current recommendation that doing deliveries of this type really places you at increased risk. I would not recommend PPE. When we wear PPE in the emergency department or in the field, as Dr. President said, the actual greatest period of risk is removal of that PPE, and we actually go through training. And when I remove my PPE, most of the time in the emergency department, I actually have an observer watching me to ensure that I do it correctly. And so we would actually not currently recommend that sort of delivery service wear PPE, because I don't think it changes much of anything. I think maintaining 6 feet, minimizing the time of exposure to another individual, even some of our more infectious, we hear from our colleagues like in Italy and New York that it still takes, they're finding that it still takes 10 or 15 minutes around somebody before they really think it's quite catchable. So I think, again, being smart, maintaining distance. If you interact with somebody closer than within 6 feet to go ahead and practice that hand hygiene in between those interactions. And if you're receiving a delivery, same sort of thing, just making sure that when you accept a new package or something like that, that you wash your hands before opening it and that sort of thing.
So then, Dr. Sani, just to follow up on what you're saying, then did you just relay that the most sort of the critical part is taking off the PPE, and that's when sort of you're at most potentially at risk? Well, some people who are on right now, since they might have some of the PPE, do you want to go into a little bit about that, about what the right procedure is to take it off?
I don't actually.
Okay.
And the reason is because we actually train on it and have to be checked off on it.
Oh, okay.
Before, when we do that. So the biggest piece of advice I can give is, making sure that you're not contaminating yourself while you're removing it, and making sure you're washing your hands after you remove it.
Well, that's what I'm going for.
And I think that the other piece is, in terms of masks in the public, the point of wearing a mask in public, if we move into that direction, is the mask wearer isn't protecting themselves. They're actually protecting everyone else from them. The idea is that the mask collects their droplets, not that it prevents other folks' droplets from coming to you.
Yeah, okay. That's a good point. Shirley?
I want to add one thing also,
Mhm.
just that might address many questions on this call, is to really always go back to the fundamentals of infection control. So OSHA has really clear guidance on how to do this, and the best controls are the engineering controls. So looking at increasing airflow, for childcare, I know that the Oregon Department of Education has some guidance around taking away sensory tables and water tables, and sort of the things that you can do in the environment to decrease risk. And then you have administrative controls that really look at sick leave and ways of implementing policies for people to go home when they're ill. And then, things like making sure that you have tissues there, as well as safe disposals. And then personal protective equipment is always sort of the bottom of the rung of infection control. And setting up an environment that is as protective as possible for those working in it is more effective and more important.
Okay. All right, thanks very much, and thanks, Shirley, for that question. Again, if you are interested in posing a question, you can always, for any attendee who is on, you can use the raise hand feature on Zoom. That's in the raise hand button is in the Zoom bar at the top or bottom of your device. Or if you're on the phone, again, we have 5 call-in listeners right now, you can hit *9, and that will indicate to me that you would like to raise your hand and ask a question. I can move you over and call on you when appropriate. I don't see any questions right now. We did get a couple of quick things in the chat, so I will go ahead and look at some of those right now. I guess there's some thoughts that companies are moving toward requiring temperature checks prior to the start of employee shifts. And somebody's just asking if that's applicable for local governments, or if there would be a recommendation for that. I'm not sure if either of the doctors want to speak to that, or if that's more of an operational question. What do we think about mass sort of temperature checks? Nope. Oh, go ahead.
I mean, I think it's more operational. I think that fundamentally, if you're sick, you should stay home. How individual operations want to apply that is sort of up to them. And I think part of it is risk. In the healthcare world, we are considering kind of everybody exposed. Mm-hmm. So, I check my temperature twice a day. They check my temperature when I go to work too. So,
okay.
I think though, if that is going to be implemented, it should be in the context of a general symptom check as well. Temperature is nice because it's an objective number that you can work on. But many people don't have fever as the first sign of illness. I think most people don't, and many people don't have fever at all during this illness. So you have to kind of be aware of those caveats if you are going to be doing temperature checks.
All right, very good. There was one more that came in via chat. It appears to be from someone involved in some capacity, the municipality of West Lynn. They're talking about an ad from the state of Oregon that says "Stay home or people will die," but they're wondering if public works staff should continue to do tasks like street sweeping or mowing, where they can maintain personal protection, or should they sort of, stay home? I guess this is a larger question of safety, just in regards to if people can still go ahead and practice social distancing in their work outside, like street sweeping, probably a good example. Is that still relatively safe?
The governor's has specific guidance around this. They have a list of sort of jobs and tasks that are that have businesses that must close. They have a list of businesses that absolutely can stay open. And then there's this sort of job and task list that's sort of in between. And I think the guidance is pretty straightforward. If you can do your job from home, then you should still, maintain your business and do your job from home. And if you can't, and you're not in one of these required closure classes, if you're able to do the job in a way that you can maintain the social distancing, then it's still okay to perform. And then I think if you throw in tasks like public services, street sweeping, those are, I think, fairly essential to keep our communities clean. But I think following the governor's guidelines, if you're not one of those required mandatory closure, then evaluating your ability to keep people in a safe social distancing is what I think you need to do at each individual job.
I completely agree. Yeah.
Okay, excellent. Thanks very much. Another question has come in. Again, if you have questions or you have a question that you would like to pose to the doctors, please hit the raise hand feature on Zoom, or if you're on the phone, go ahead and hit *9, and then we can get to you. Another question that has come in. Do you have any information on later reinfection of COVID-19 for those that were already confirmed as having the virus previously?
What I know is that it's being studied. And the general thought right now is that if you have it, you will not get it again, at least not in the near future. As far as, if it mutates like a flu virus does, or many coronaviruses are causes of common cold that will mutate, and so you can get a similar one later. But still, that we would expect to be less severe if you were to get it again. So you already have some immunity built to it, and if the virus itself mutates slightly, you may be able to get it again, but you would likely have very less severe illness, and it's likely not to be anytime soon.
There are media reports around reinfection, but there's no sort of hard scientific data. The closest thing that we have is the initial SARS that primarily hit Toronto, as well as MERS, which is another coronavirus. And there does appear to be, having read through some of the papers, they felt that there were at least a couple years of immunity to both of those, and that they're not seeing reinfection with those. So it's hard to know, too, that some of these reinfections they talk about are situations where somebody tests positive, then tests negative, and then tests positive again. But we also know that the test has a lot of limitations. And so it may be that the kind of in-between negative test was a false negative. So at this point, we don't have any hard and fast data that says that reinfection is possible, and all science is speculative, and we speculate that this is most similar to the other SARS, the initial SARS virus, which did have immunity.
All right. Thank you both very much for that. Another question that's come in. Can you provide guidance on cleaning or disinfecting protocol for businesses if someone in the workplace is shown to have COVID? It looks like what they're going for here is when that happens and it's confirmed that someone tests positive for this, should staff be sent home, or for how long, or what's the general protocol for something like that? What would be the health recommendations in terms of keeping people away?
So we don't have any specific guidance for whether somebody a known case is there versus just our overall general guidance on increased frequency of cleaning and disinfecting. And we are not recommending that all staff be sent home at this point.
And you said earlier, Dr. President, that when that happens, it's the job of the public health department to get in touch with the company or the workplace or whatever, and then steps are taken by public health, right?
Yes, I do need to have the caveat of, as cases increase, the public health contact to employers, we are moving and have been for some time away from containment. Like I said, we're not going to be able to isolate ourselves out of this to mitigation. And so that's where the social distancing measures and these general workplace, everybody should be taking extra special caution at all times. That's really going to go much farther than the public health department contacting you. We are looking at high risk individuals and close contacts, and but most people, if you're able to, affect the workplace to keep it as safe as possible, will not have close contacts in their workplace. Oops, my light just turned out. I'll get that back on in a second.
Okay.
So.
I thought that meant we were done when your light turned off. I don't just. Yeah.
But you guys can still see me, right?
We can still see
yeah,
you.
we can still see you.
It's fine. It's fine. Dr. Sani, do you want to add anything to that, or are you good?
Nope, I think she hit all the points.
Okay, great. I don't see any more questions from attendees. There is one more in chat, which I'll get to, but we will go ahead and end this session early if we don't have any more questions from attendees in just a little bit here. So again, if you would like to participate, if you have a question that you would like to ask, please hit the raise hand feature in Zoom, or if you're on the phone, hit *9. Otherwise, we will probably get going here pretty soon. The other question that we've had come in just via chat real quick, this is going to be speculative, I'm sure, but somebody's asking in general, how long do we think we're going to be in this sort of mode before we get back to normal? I think that what people are probably wondering is best guesses in terms of when we will not be staying at home or under that order. Of course, that's the governor, that's her purview, she can do whatever she wants, but I guess maybe a better question is, when will we know if we start flattening the curve and we can start to go outside and not have to worry so much about social distancing? Obviously, it's a long time, but what are the first indications, I guess?
I mean, I would say that we already have data that we're flattening the curve. Our projections that we were seeing a few weeks ago had us hitting a period of sort of hospital overflow like this week. And the most recent projections have us not really getting there. And one of the things is that as you flatten the curve, as Dr. President said, you don't necessarily reduce the overall number of people who get infected, although a big part of our strategy is to try to prevent infection in those high risk groups all the way across the board. But as you flatten the curve, one of the kind of downsides, if you will, is that you then spread out the length that it takes for this to move through the system. And so one of the projections had us reaching a peak in early April, and then now in mid-April, and now one of the ones that we just saw a couple days ago had us peaking in early May. And while that sounds like, oh, that's over a month from now, that means what we're doing is working. It means that we're kind of spreading we're making the spread of the disease kind of move slower. So I think we already have indications that we're doing the right thing here, and that flattening the curve and is working, and that we started our distancing process early in the event compared to other communities. It might have been the same day as Washington, but we're about 3 weeks behind the Seattle area in terms of first case and how fast the cases have risen. So, and then for duration, I don't know. I think the biggest issue, I think we have to be careful that when things are looking better, that people don't go back out too quickly. Right. And start reinfecting people and spreading, kind of having a sudden ramp up in the infection rate. And so I think that it's just sort of a situational decision that our public, that the state public health will work with the governor and kind of ultimately make those decisions kind of based on what the situation looks like.
Excellent.
Yeah, I think Dr. Sani just hit the nail on the head with a lot of the unknowns, but a lot of the positives of spreading it out is a good thing, and we're saving lives that way. One other sort of projection thing to think about is if there is a vaccine that is made, then that helps things a lot, but that's looking at 12 to 18 months earliest. I don't think that we need to wait that long. I also want to just sort of have us all of us on this call are in leadership in some point, in some way, and think about what return to normal is, and think about how you can be a positive force or an inspirational force in this is disrupting everybody's life, and what our normal returns to is never going to be the normal we had before. We're learning all sorts of things about our community, about how we interact with people, and focusing on finding the positives that come from this. And then when we get back to normal, having, bringing up the positive learnings from this experience to have our new normal be as supportive of each other, as community oriented as possible. I think there's a lot that we can be thinking about in this next month about how we do return to our new normal after this.
Thank you. Very well said. So, attendees, I do not see any other questions. Again, last chance, last call, if you will, to hit the raise hand button or on the phone, *9. I guess for both doctors, if there is any closing thoughts that you have on this, we can go ahead and say those now, and then I think we'll wrap up right after that. Not to put you on the spot. If you don't have anything, that's fine. But go ahead.
I would just say once again, thank you for all the work you're doing. I see some of my fire colleagues on the call, and I'm just really proud of the work that I'm seeing across the board from our line personnel, from our management. So thank you all for everything you're doing.
Yeah, I agree. Everybody on this call is doing so much to help right now in these really strange, weird, unprecedented times, and thank you.
All right. Well, thank you both for joining us today, and thank you both for the continuing work that you do in trying to keep us all safe, or in keeping us all safe, not trying to. My apologies. Don't know why. Okay, so thanks everybody. I know that we had between about 50 and 65 attendees the whole time. Really appreciate it. If you have any recommendations as to future topics that we can go ahead and produce related to COVID, obviously, or if you have any operational questions as far as the county's response to the pandemic or operations we put into place, best thing to do is go ahead and email EOCPIO, so at clackamas.us. That's like the EOC, the Emergency Operations Center Public Information Officer, EOCPIO at clackamas.us. With those. We will also go ahead and archive this session and send out a link to those who were invited to it in the first place for you to share with whomever is relevant to the conversation. So, Dr. President, thank you very much. Dr. Sani, thank you very much. And thanks to all of you for attending today. That will conclude today's webinar. Thank you.